everyone, my name is Christine Erickson, and today I'm going to be presenting a SWOT analysis for St. Mary's Medical Center. First, we're going to start by talking about our objectives. The objectives for this presentation are to provide a brief overview for St. Mary's Medical Center. We're also going to define what a SWOT analysis is, and then we're going to discuss the SWOT analysis that was performed for St. Mary's Medical Center. First, as I said, we're going to start by giving a brief overview of St. Mary's Medical Center. St. Mary's Medical Center is located in Duluth, North Carolina. We opened August 1st, 1970. That's when we saw our first patient. We have grown tremendously since that time. We now have 250 acute care beds, and in 2014, we saw 317,000 patient visits. And we also have 2,600 employees that are staffed by St. Mary's Medical Center. We offer comprehensive care, especially in the areas of cardiac care and oncology. We're going to briefly discuss the mission statement and the values that we have here at St. Mary's. Our mission statement that is listed in our employee handbook on page 2 states to improve the health of all people by providing comprehensive and high quality care in a respectful and compassionate environment. Our values include service, teamwork, and respect. Next, what is a SWOT analysis? Well, SWOT stands for strengths, weaknesses, opportunities, and threats. And we perform this analysis on St. Mary's Medical Center. Now we're going to talk about the findings. The organizational strengths that we found for St. Mary's included highly skilled clinical staff. As I stated, we pride ourselves on the exceptional cardiac care that we provide. We have a 24-hour staffed PCI unit with interventional cardiologists that are staffed 24 hours a day. We also have comprehensive cancer care as well. We have diagnosed and treated more cases of breast cancer, the most cases in the state of North Carolina. Opportunities for advancement. We pride ourselves in offering many opportunities for advancement for our employees, especially for our nurses. With each department, there are different opportunities available. For example, within the emergency department, we offer advanced EKG monitoring and interpretation. We will provide for classes for CEN, or the Certifying Emergency Nurse exam. We offer classes, preparatory classes for that, and employees are paid at their normal rate of pay. We will reimburse the testing fee that it costs to take the certification exams for all employees. If they pass the exam, we will reimburse. And we also offer interdisciplinary shared governance team. An interdisciplinary shared governance team has a representative from each department that meets monthly. We found that having the input from all departments really helps provide more comprehensive and more complete patient care, and nurses have really significantly contributed to this, providing a higher quality of care. We have a new graduate residency program. Not all hospitals offer this. We feel very strongly about new graduate residency programs. We have looked at the research by Ulrich, and we understand that they can significantly decrease the turnover rates. The turnover rates for new graduates have been reported anywhere from 13 to 75%, and we have seen a significant decline in new graduate turnover with the implementation of new graduate residencies. We also, the Institutes of Medicine and the Robert Wood Johnson Foundation released their report, The Future of Nursing, Leading Change and Advancing Health. When they released that report, they stated that nurses should achieve higher levels of education and training through improved education system that promotes a seamless academic progression. We believe strongly in that, and we want to help promote nurses to achieve higher levels of education. Therefore, we have collaborated with schools of nursing to facilitate this by adding additional clinical sites, and we're going to talk about that a little bit more, but we believe very strongly in that, and the community universities and colleges that have been associated with our facility are definitely, we have open communication with them and communicate with them on a monthly basis. Our organizational weaknesses. This is the W in SWOT. The first one that we identified as a weakness came after we conducted an employee satisfaction survey. And one thing that was identified was the non-adherence to break policies throughout the hospital. This is happening in nearly every department. The break policy in the handbook states that for every 4 hours worked, a 10-minute paid break should be given. However, this is not happening, so this is one of our weaknesses that we definitely need to work on, for this can contribute to nurse burnout and compassion fatigue. So we understand that our policy is not being adhered to for breaks and even for lunch breaks. The new graduate residency program has a policy on transferring residents. For example, let's use the emergency department again. If a new graduate completes the nurse residency program for the emergency department, which is 6 months in length, and at that 7th month they decide that this is no longer for them, that they can no longer complete this, however they want to stay with the facility, it is currently written in the policy that they cannot transfer out of that department until their years of service have been completed. Therefore, we are losing money that we are investing into these new graduates. It has been recommended by other supervisors and leaders within our system that if we could just transfer them to another unit, they still have the computer skills that are taught to them, and basically the facilities training, if we could just work out how to transfer them. But that has been identified as a weakness. We also have identified in the staffing satisfaction survey, we noticed that there have been significant staffing shortages, and leaders within the institution have told us this as well, that they're having trouble staffing adequately to provide the care that we need to provide, safe care. I've taken an example from one of the staffing surveys, and this is an example of what one of them wrote in the commentary. They stated that our unit was almost always short-staffed, so we were often forced to accept more patients than we needed to. The ratio was supposed to be 1 to 5 at most, but we would sometimes go up 1 to 6. It didn't happen all the time, but when it did, it was very stressful and it felt unsafe. This was an anonymous staff RN reporting from the medical surgical floor. So we've identified this as a weakness, that we are experiencing nursing shortages. An opportunity, this is the O part of SWOT, organizational opportunities. We are excited to be building onto our facility. We have an addition of 1 new medical surgical floor and a new surgical suite that we are very excited about. We're going to soon be offering robotic surgery. We are pursuing magnet designation by the American Nurses Credentialing Center. If you don't know, it is a very difficult process, so we are currently pursuing that at this time, but look at this as a huge opportunity for growth. We have agreed to become a clinical site for Clark University, so this is a huge opportunity for us. We are branching out into other universities and institutions of higher learning. We hope to gain new graduate nurses from this relationship. And we're also expanding tuition reimbursement and the addition of scholarships presented by the St. Mary's Medical Center Auxiliary Volunteers. For example, they have the Mary Phillips Scholarship Fund, which applicants can apply for. They encourage ASN applicants to apply for so they can merge into a BSN program. So we're very excited about this opportunity. Next, we're going to talk about organizational threats. First off, we know there's a nationwide nursing shortage. We're clearly seeing it in our weaknesses that we do not have enough nurses to adequately staff. We have implemented the new graduate residency programs, which is helping. However, we need to further amp up that, but it is a nationwide problem that we're trying to address. Also, another threat that has become apparent is the Blue Ridge Medical Center. They have opened an urgent care about 10 blocks from our hospital. Their urgent care, whenever there's an emergency there, they will refer to their hospital, which is in the 2 counties over, or a county over, excuse me. They will refer to Blue Ridge Medical Center for care. And so this has taken away some of our patients that could potentially be coming to our facility. They are also, they are buying up roadside billboard advertising on the major I-26 roadway. They are advertising for their facility, stating that they have been voted #1 cardiac care, which is true. They have been voted #1 cardiac care, and other opportunities that they have. So it has taken away some business from us, but we will continue to evaluate this threat. These are my references for this presentation. If you have any questions, please feel free to contact me. Again, my name is Christine Erickson, Christine.Erickson, ERICKSON, at my.lr.edu. I'd be happy to answer those questions for you, or you can post them below to the discussion board and I'd be happy to answer those questions for you. This concludes my presentation. I hope you have a wonderful day.